I've identified my patient and I've explained the procedure to them. I've got an order for some medications. I'm gonna go take a look at your chart, go to the med room, get all my stuff together, and then I'll be back in to give you some stuff. Okay, cool. So then I'm gonna wash my hands, I'm gonna apply my gloves. Then I'm going to review the order. So I have an order to start normal saline, and I also have an order to give some antibiotics to be announced. We'll figure out what they are. And then I'm also going to give an IV push. So I am going to assess my 5 rights, make sure I've got the right meds, the right route, the right patient. I'm going to assess their allergies to make sure that they're not allergic to anything, and I'm also going to check the compatibility of all 3 of these drugs that I'm going to administer before I go into the patient's room. If at this point I needed to calculate any drip rates, this is when I would do so. So if I had fluids that I was going to be hanging by gravity, I would look at the drop factor of my tubing, the mLs per hour that are ordered, and figure out what I need to be doing as far as that is concerned. Okay, so then I'm going to gather all of my supplies. So I've got my primary bag, my antibiotic, a couple flushes, my secondary tubing, my primary tubing, needle to draw up my IV push meds. I've got my hanger to allow for the different levels of my fluids, and some tape. I'm going to use this to label my tubing and my bags. So now I'm going to assess the IV site. So I go in, and the first thing that I do is I look at it to just make sure it's not red, swollen, draining, oozing, crusty, gross. If it were red and swollen, I would remove it and document that and attempt to start another IV. Let the doctor know. That might be another site of infection that they might have to potentially be concerned about for this patient. So everything looks okay here. This dressing is time dated and initialed. Everything looks good. So I'm going to grab a flush and my alcohol pad, and I am going to scrub this hub for 15 seconds, let it air dry. I'm going to take my flush, connect it, then I'm going to aspirate to see if I get any blood. I did. Then I'm going to flush with the full 10 cc's slowly. So the reason that you flush with the full 10 cc's slowly is because you're not sure. I mean, you can tell by looking at the chart, but if there was a medication that was administered and some of it is still in there, and you take that flush and you slam it, then you just pushed all of that into the patient. Or if you go to flush it and you meet resistance and you're pushing really hard, there may have been a little clot at the end of there and you just dislodged it. Now it's floating around your patient trying to look for a place to land. They can have a stroke, they can have a heart attack, they can develop a DVT, any number of things. So when I'm flushing that, I can assess up above it to make sure that it's not swelling, that I'm still in the vein. Everything looks good here, so I'm going to go ahead and prepare my primary infusion. So I have my primary infusion bag, and it's important to remember that when you are preparing this, that once I take this cap off, this is sterile, and once I take this cap off, this is also sterile. Okay? So what I'm going to do is I'm going to place both of these in my hands like this. I'm going to pop this off. I'm going to grab this. Woo, squirt water everywhere. That doesn't happen in real life. And then I'm going to spike my bag. While I'm still here, I'm going to make sure that this is clamped. You can either clamp it before you put it into the bag or clamp it before you flip it over. Because from here, I'm going to flip it over. This makes sure that there is no potential for air to get in my line. So then I'm going to prime my chamber. Grab this up off the floor. Good thing is the cap is still on it. And then I'm going to prime my tubing. I'm just going to hold this up and watch this go through until all of this air is out of the line. Alright, and we're good. So I'm going to clamp that off. And I'm I'm going to go ahead and hang this up onto my pole. And just loop this over top. The cap is still on it. Okay. So now I'm going to take this line and lay it next to my patient. I'm just going to loop it around here so that way it stays. I'm going to take a clean alcohol pad, a new one, and I'm going to scrub my hub for 15 seconds. I'm going to let it air dry. I'm going to remove my tack and attach it to the patient. So from here, I would then open my clamp while looking at the clock. I'm going to count my drips for a full 60 seconds to make sure that I have the appropriate drip rate. Then from here, I've got my primary infusion going. I am going to time, date, and initial the bag. I would also put the patient's name and date of birth on it, making sure not to cover up the label of the medication or any of the information. So I would probably put it back here, making sure not to cover up the expiration date and the lot number. And then I'm also going to time, date, and initial and label my tubing. So you can just peel this off, place half of it on the disc, write your stuff on there, and then you would clamp it around the tubing. And then you would do the same for the bag. Alright, so all of that is labeled. Now I'm going to go ahead and prepare my secondary infusion. So I am going to get out my secondary tubing, which looks like this. I'm going to go ahead and clamp it. And then I'm going to go ahead and spike my bag. So I'm going to take this off of here, take that off, making sure not to touch that on anything, and spike my bag. So then I'm going to flip it over, I'm going to prime my chamber. This one actually has little lines in the bottom of it of where you prime it to. This makes sure that you have enough space to appropriately count your drips. Okay? So then I am going to let that prime till all the air bubbles are gone. I'm going to reclamp it. I'm going to hang it up here. Now, because all of this is going in by gravity, I'm going to go ahead and clamp off my primary tubing. I'm going to grab my extender. Taking primary tubing off. My primary infusion. I'm going to hook this here. And then hook this infusion down lower. So when you're hooking all of this up to, one thing that I failed to mention was that you have to be sure that you know the drop factor of your tubing. That will be on the package of your tubing to let you know how many drops per ml that tubing is rated for. Okay? So now that I've got that hung up there, my order was verified when I gathered all of my meds up. So now I'm going to get ready to start this. So when you are attaching a secondary IV line to a primary line, you want to use the port closest to the primary line. So I'm going to use this port here. In the event that you have a pump, there is typically a port on the cassette that goes into the pump, or if you're using an Alaris pump, there are multiple ports in the primary line. You just want to make sure you're using the one closest to primary bag. Okay, so from here, I am going to clamp that. Already did that. Cool. So now I'm going to clean this port for 15 seconds. Let it air dry. I'm going to grab a flush. I'm going to go ahead and connect it here. And then I'm going to clamp it up above where I've connected it. I'm going to unclamp the tubing. And I'm going to flush it. full 10 cc's slowly. So now that I have done that, I'm going to disconnect this. So that clears my line to my patient. If there were any meds left over or anything that was potentially going to cause any issue with this medication, I know that they're just getting this med. Okay? So then I'm going to clean this cord again. Reclamp. Then clean. Clean for 15 seconds. Let it air dry. You can release that hand clamp at this point because everything's locked in position. Nothing's going to flow down into this line because I reclaimed it. So I cleaned it. I've let it air dry. Then I'm going to take this secondary line, disconnect the cap, and plug it into the port. Now this step is important. You have to undo the secondary clamp before you undo the primary clamp, because if you undo the primary clamp and this one's not undone, this will start to go in. You just cleared your line. You want this medication to be what's going into your patient. So you unclamp the secondary line, unclamp the primary line. You're going to watch your drips for a full 60 seconds and use your roller clamp to adjust it as necessary if you need to slow it down or open it all the way up if it needs to be as fast as the tubing can go. Okay? So then after that, I would label this medication just the same as I did the other. So I'm going to time date and initial when I started it. Put it on the bag, making sure not to cover up any identifiable points on the bag. And then I'm going to label my tubing. I'm going to time date and initial. And I'm going to put that here. Another thing you can do when you're labeling your lines in order to save yourself time and headache is you can write the name of the medication on there as well. So if you have a patient that's got 10 lines going in 3 IVs, you can quickly identify which line needs to be taken out. So for example, if I ended up wiring something into this patient down here too, I would label this as 0.9 and I would label whatever's coming in here as whatever it is. Say for example, it's magnesium, potassium, something like that. If the patient starts to have a reaction after I initiated this medication, I know I just need to unplug this and get it off of them as quick as possible, stop this, and then get the IV out. Does that make sense? Or if you're using nitro or something like that in your patient's blood pressure tanks, you know exactly where your stuff is that you need to pull off your patient as quickly as possible. Okay, so I've got everything there. Everything's open and running, so my primary and my secondary are going. The cool thing about this setup is that as this runs out and the air comes down the line, this will take over so you're not air bolusing your patient. But you still want to watch this. If you know how long this is supposed to take to go in, you still want to come back in and check it. Let's see here. So now I'm going to give my IV push. So when I am preparing this medication, I've already checked that it's the appropriate medication, the appropriate dose, the route, the patient, the time, and I'm going to remove the cap. Then I'm going to take a new alcohol pad and I'm going to scrub the top of it for 15 seconds. Let it dry. So this patient is ordered 4 milligrams of morphine, which is 1 ml, so this is 4 milligrams per ml. So I'm going to take my needle and I'm going to draw up 1 ml of air. Put my vial up, inject it. I'm going to pull my needle down, draw up my 1 ml. Making sure that there are no air bubbles in my syringe. Woo! So then I know that morphine is supposed to be given slowly. So I'm going to take this 10 ml flush, and because it is 1 ml or less, I'm going to squirt 1 ml of water out of this. While I still have this clean and I just uncapped this, I'm going to take my needle into there and insert the medication into the syringe. Okay, and I'm going to deploy my safety, dispose of that in the sharps, and I'm going to gently roll this around to get it nice and mixed, making sure not to touch the top. Okay, so then my cap that I took off, I left face up, I can recap it. Okay, so this is my morphine. If I am mixing this into a syringe that is not labeled, I have to then label it with the patient's name, date of birth, the medication, and the dose. So then I put that here. And then I set it down and I'm getting ready to administer it to my patient. So from here, I'm going to stop the primary infusion first because my secondary is running in right now. I'm going to clamp this line and then clamp my secondary. Okay? So then from here, I'm going to choose the port closest to the patient to administer this medication. So one thing that you can do in order to save yourself from having to hand clamp, if I open these back up, if I pull this down to this hub, and then I clamp it here, then you don't have to hand clamp above this site, okay? Then I'm going to clamp my secondary. So my primary and my secondary lines are both clamped. I've selected the port closest to the patient. Got my medication drawn up. I'm going to clean this hub for 15 seconds. Let it air dry. I'm going to grab my flush, connect it. I'm going to flush a full 10 cc's very slowly. This is empty. I'm disposing of it in the trash. Then I'm going to remove that syringe. I'm going to re-clean the hub for 15 seconds, let it air dry, uncap my medication. I'm going to connect it and I'm going to administer it slowly. So I'm going to give this over about 3 minutes. So I'm just going to sit here, I'm going to look at my clock, I'm going to watch. Just give little, slow, steady pushes. Once I'm done administering that, I will disconnect my medication syringe, clean again, 15 seconds, let it air dry, grab a flush, connect it, flush it at the same rate for the full 10 cc's. Then I'm going to disconnect, going to dispose of everything as necessary. Then I'm going to open my secondary line so that my secondary infusion can continue to go in, and then my primary line. Okay, so I'm all done with that. Then I'm going to dispose of everything as necessary. So this had medications in it. I'm going to go ahead and put it in the sharps, just because if there's any remnants of morphine in here, I don't want anybody to get a hold of this in the trash. So I put that in the sharps, this in the sharps. The safety is on this, and it goes in the sharps. And I clean up my area, and then I'm going to document my administration of all of my meds. So the cool thing about doing all of this like this is that you've time dated and labeled all of your stuff, so you know exactly what time you started it. So in the event that this took you 15 minutes to do, you know what got started when, and what was administered. And what was administered when. I'm going to show you really quickly how I would administer adenosine if I were giving that. And we're going to say that this 1 ml here, what we'll do too, is my adenosine with the cap on it. And this is a full flush that was not morphine that I just gave to my patient. So I would come in, my order's been verified, everything's checked out. I would clamp my primary tubing down close to my hub, closest to my patient, and then I would clamp my secondary. So from here, I'm going to clean this hub for 15 seconds, let it air dry. Then I'm going to take the cap off of both my flush and my medication. I'm going to hook up my adenosine, and I'm going to slam it, slam, grab another 10 cc syringe, and flush slowly. You don't take the time to clean in between.